afternoon. I would like to start out by saying thank you for the invitation to be here today. My name is Michelle Reardon. Closer. My name is Michelle Reardon. I'm a registered nurse, mother, caregiver, and advocate for my 24-year-old daughter, Alexandra. I would like to begin by sharing Alexandra's journey with TMD. Alexandra has suffered with TMJ pain, migraines, neck and back pain since she was 14 years old. Early on, it started as minor discomfort, but seemed to escalate year after year. Over her teenage years, we consulted with her PCP, neurologists, dentists, and oral surgeons. We were told by the neurologist that her chronic headaches were probably hormonal as she was entering into puberty. The dentist felt she ground her teeth at night and subsequently fit her with multiple orthotics for her to sleep with. And the oral surgeon felt she needed her wisdom teeth extracted. Ultimately, none of these treatments or interventions would help to alleviate her discomfort. The period after her wisdom tooth extraction in 2010 would follow with a definitive increase in TMJ pain. By 2014, at 20 years old, in her second year of college, TMJ pain, neck and back pain, and migraines had suddenly grown in intensity and frequency and significantly began to affect her once normal life. It affected her ability to focus in school and started to impact her ability to function day to day. Approaching her 21st birthday, she started to significantly lose function of her jaw. Her facial muscles became incredibly tight, her mouth opening began to rapidly shrink, her ability to chew diminished day by day, and her pain was off the charts. She became nutritionally compromised as well and began to lose weight. Pain, despair, and anxiety were now a part of her everyday life. In her fourth year of college, majoring in nursing, she was forced to take a medical leave of absence in an attempt to manage her pain and identify the root cause of this agony, which was now part of her daily existence. Her life was abruptly placed on hold. Through the years, we sought out the best dentists, doctors, and oral surgeons in the Boston area and even traveled across the country to consult with doctors in search of answers. We consulted with over 33 doctors and dentists in all. She had diagnostic testing, x-rays, MRIs, and blood tests. On the advice of oral and/or maxillofacial surgeons, she had arthrocentesis twice, steroid injections twice, Botox injections 3 times, and arthroscopy. A diagnosis of TMJ, severe bone degeneration, bilaterally displaced discs, and increased inflammation were given, but no explanation given as to cause. Due to unbearable pain 6 months post-arthroscopy, she had a cone beam CAT scan and a bone scan. We received the devastating news that her bilateral condyles were largely destroyed, and she was now considered a candidate for bilateral total joint replacement at 21 years old. When I inquired as to what the cause was of this advanced bone degeneration in such a young person, 2 oral maxillofacial surgeons offered a general diagnosis of probably something arthritic, and we were asked was she ever worked up for juvenile arthritis. The recommendations given were to obtain a rheumatology evaluation. 1 oral maxillofacial surgeon recommended arthroplasty, the other recommended a TJR on her left side, which at the time was worse than her right. We consulted with 3 different rheumatologists, which yielded no definitive answers. Despite no definitive lab results, we were given a diagnosis of seronegative spondyloarthropathy. Methotrexate was recommended to be started immediately. Starting my almost 21-year-old on a chemotherapeutic drug like methotrexate was not an option. I decided on my own to have a full medical workup on my daughter, including a battery of blood tests, many of which I had to pay out of pocket. And finally, I started to get more answers. Alexandra was diagnosed with Lyme disease, Bartonellosis, and a malaria-like infection called babesiosis. Over the next year and a half, she would also be diagnosed with hypothyroidism, postural orthostatic tachycardia syndrome, complex variable immune deficiency, mast cell activation syndrome, dysautonomia, small intestine bacterial overgrowth, small fiber neuropathy, Ehlers-Danlos syndrome, and anxiety. Had we started her on an immunosuppressant therapy, who knows where she would be today. If she had gone ahead with TJR surgery with this high bacterial load in her body, she would surely have begun the journey down the black hole of surgeries that so many of these amazing women who have spoken here today have endured. Alexandra is now almost 25 years old. Her jaws continue to deteriorate. She lives every day in chronic, relentless pain. Her jaw function is very poor, and the opening of her mouth continues to shrink. She can only tolerate very soft food, purees, and liquids. Pain management has yielded little to no relief. The entire process of seeking pain control and management has been an awful experience in itself. The suffering and inquisition is awful. The agony that my daughter suffers most days is so bad that she literally wishes that she could die, a statement that no parent should ever have to hear. She cannot work and has been unable to finish college. Most of the week is spent in bed trying a multitude of therapies, interventions, in an effort to alleviate her pain. Many of her friends have moved on in life without her, and she has been left feeling isolated and alone. To top it off, most people say that she does not look sick, so many times her struggle is dismissed. She lives on a very limited diet. Ultimately, mealtime has become the time of day that she dreads, as she knows that her pain will only worsen from jaw movement. Because of this journey, I no longer trust what dentists and doctors recommend, and I question everything. This is due to all that has been overlooked, all that remains under-investigated, and to so much that still remains unknown about this horrendous disease. It is sad to say that I've lost faith in medicine. This must change. As a parent, there is nothing worse than watching your child suffer. We want so desperately to see our children happy and healthy. When illness and pain wreak havoc on our children, we as parents want nothing more than to fix it. I can't fix this. The problem is, with temporomandibular disorders, there are no quick fixes, no simple procedures, no magic potions or magic plastic to make it better. Many patients and loved ones struggle to find answers to medical questions that research has yet to provide, and they are left with frustration, heartbreak, pain, and loss with this dreadful disease. Many dentists and physicians are overconfident and over-optimistic when they sell treatments based upon their own theories and beliefs and not on scientific evidence. TMD is completely misunderstood and underestimated by most medical professionals. Almost every doctor that we have taken Alexandra to outside of oral surgery have never even heard of a total joint replacement of the jaw. There is simply not enough awareness of just how devastating TMD can be, not enough research or long-term follow-up of the TMJ patient being conducted. Dentists and doctors seem to focus on TMJ as just a joint and do not look at the whole body and all of the possible comorbidities. If there were more multidisciplinary collaborations taking place, I feel it would become more transparent that TMD is truly a complex medical condition. This was also documented in the OPERA study, where the need for multidisciplinary collaboration was indicated. This is an example of what Alexandra's multidisciplinary team that I put together has looked like. Patient, parent, significant other, primary care physician, dentist, oral surgeon, oral maxillofacial surgeon, rheumatology, neurology, infectious disease, functional medicine, a Lyme literate doctor, geneticist, pain management, psychology, psychiatry, nutritionist, physical therapist, and most recently, we have added a naturopath. I cannot stress enough the fact that comorbidities must be considered and investigated in a comprehensive manner. To achieve this, we need to evaluate the following. Thorough past and present medical history should be obtained, timelines of symptoms gathered to include inquiries as to the patient's perceived unrelated complaints. I am often surprised by the lack of questions that are asked. Baseline x-rays and scans obtained, referral from a dentist to a medical doctor for further workup. Thorough lab workup completed where indicated. We have also included pharmacogenetic testing in our workup, and we will soon begin medical testing. There are multiple symptoms and comorbid conditions found in TMD. These include, but are not limited to, autoimmune diseases, Ehlers-Danlos, fibromyalgia, chronic fatigue syndrome, low back pain, migraine, movement disorders, genetic disorders, systemic infections like Lyme disease, and other bacterial and viral infections. In both TMJ and Lyme patient communities that we are involved with, many commonalities in diagnosis and complaints are seen. A very high percentage of Lyme patients experience significant TMJ and oral facial pain. The fact remains that when most people have TMJ pain, their first consult is typically with a dentist. Some critical pieces that we feel should be considered and evaluated going forward. There is a lack of medical and dental school education on TMD. Although TMD falls under the auspice of dentistry, the Council on Dental Accreditation does not require undergraduate dental schools to provide any educational experience in TMD diagnosis and treatment. There are approximately 24 dental organizations, each recognizing their own method of treatment to be effective in diagnosing and managing TMD. Many times, these treatments can result in irreversible jaw repositioning, chronic pain, and severe degenerative changes to TMJ. Many of these damaged patients are mismanaged, misdiagnosed, mistreated, and dismissed, thus resulting in more significant anatomical loss, ultimately requiring a total joint replacement. Postgraduate dental training is largely unregulated, and there is no way to assess the quality of what is being presented to these dentists. We know that TMD is a complex disease. There is very little, if any, collaboration with other medical disciplines. We need more evidence-based research to validate diagnostic methods. We need formal treatment guidelines for TMD treatment. We need to conduct more long-term studies on efficacy and harm of treatments and eliminate the inconsistency of treatment plans that currently exist. There is little to no patient-centered framework. There is a lack of transparency with regards to the patient, clearly understanding the risks and benefits involved in treatment. We need improved registries that cover the broad spectrum of the clinical and physiologic biomarkers of patients and treatment outcomes. We need to improve education and understanding of pain and conduct research on adequate pain management as it relates to TMD. We need advances in regenerative medicine as it applies to the jaw. Simply said, there is not enough science, not enough research. Here are some of the thoughts that plague patients every day. Why are we still so many years behind orthopedic advances that have been made? How can people still be suffering? How many are being left disfigured and disabled every single day? Why aren't those patients being educated on the risks of these treatments? How many are being dismissed and abandoned by their doctors? What options do patients truly have? So many patients are desperate and suffering needlessly. My hope for the future is that my daughter and others like her will be able to hold out long enough to have an option other than total joint replacement. That research might bring us closer to stem cells or tissue regeneration, saving her from a lifetime of continued pain and suffering with a surgery that still holds so many uncertainties. I hope that those of you seated before me will be able to recognize the urgency of many of the critical points that we have all addressed here today. I hope that you can see the medical chaos many have endured, the unnecessary pain and intense feelings of fear, as well as our desperate need and desire for change. With your attention, diligence, and commitment, you have the power to transform the future of TMD research and treatment. If we do not have science, we have nothing. It has truly been an honor to speak before you today. Thank you for your time and attention. And I would now like to introduce you to my daughter, Alexandra, to share a few of her thoughts.
Good afternoon. Thank you for inviting me to be here to speak before you today. I would like to take a few moments to share some of my thoughts, concerns, experiences, current symptoms, and ongoing experience with TMD. I'm about to get married in July. I am marrying someone who has been with me throughout most of this journey and is willing to stay by my side regardless of what the future holds. I know that this dedication and commitment is uncommon for many couples faced with this disease. I am also realistic and know that the level of stress placed on our relationship will be incredibly challenging. Many patients are left abandoned by their loved ones, significant others, and friends. There are only so many times that my pain can cause me to cancel plans last minute or simply not want to socialize at all before people start leaving me out altogether. The feelings of loneliness and isolation are overwhelming. Intimacy is also affected. Whoever thought that I'd be sitting here publicly sharing my thoughts of intimacy with a group of strangers? But this is my reality at 25 years old as I prepare to get married. Most days I can barely kiss my fiancé and he fears kissing me, knowing that a simple kiss can cause an increase of jaw pain. I am hesitant to place my head on his shoulder or cuddle, as the pressure of doing so causes worsening pain. Even simple conversation and laughing can be difficult and trigger more discomfort. Pain, the thing that I struggle with every single day. The feeling that has destroyed my life and has made me question my ability to coexist with it in the future. Some days it brings me to my knees and makes me wish that I was dead. Every day I feel like I am being stabbed repeatedly with ice picks in my ears, temporal areas, and jaws. TMD causes me to have neck pain, shoulder pain, facial pain, debilitating migraines, and localized swelling. Pain control for me has been difficult to achieve. Most pain clinics don't even know how to treat TMD. When I went to pain management, I was dismissed after mentioning TMJ pain and was viewed as a drug seeker. I now carry a large 3-ring binder with me, which contains all of my medical records, reports, and images to appointments, just so that I can prove how significant the damage to my jaw really is. I cannot neglect to emphasize my loss of jaw function as another horrible reality. The act of eating is painful. I physically have difficulty chewing, my teeth no longer touch, my jaw locks, and the opening to my mouth continues to shrink. My masseter muscles are in a never-ending tight clenched position, making it difficult at times to open my mouth at all. I avoid lengthy conversations, as the reality is that I will pay for it later. Financial burdens are another challenge. Since TMJ falls under the auspice of dental, most health insurances do not cover treatment options at all. But I guess that their denial in some ways makes sense. After all, would any of us want to pay for treatment that has little research and nothing to prove its safety or effectiveness in practice? Because there are so many out-of-pocket costs for treatments and denied insurance claims, bills pile up and many patients fall deep into debt. Many go bankrupt or are left to suffer and live with this horrible disease. I have been fortunate that my parents have been able to help me. They have spent well over $125,000 out of pocket on testing and treatments over the last 4 years. This is frightening, as I wonder what these costs will climb to if I need a TJR. The sad reality is that many treatments are costly and many prove to be ineffective and unsuccessful. These are some of the treatments that I have tried, most of which have little to no long-term studies or research. Physical therapy, acupuncture, craniosacral therapy, myofascial release, IV ozone, IV laser, IV ketamine, infrared therapy, Novathorbed, which is a systemic photobiomodulation therapy, shockwave therapy to break up adhesions and blockages, 6 custom-made orthotics, NUCA chiropractic, massage therapy, trigger point injections, and 3 Botox injections. Other treatments that have been recommended by doctors that I have not yet tried include hyperbaric oxygen, dry needling, IV and local stem cell injections, and local ozone injections. Please remember that those of us suffering are desperate. We blindly take risks. We want nothing more than to get better. I was recently asked, if offered, would I ever consider taking part in research? That is a tough question. Initially, I think absolutely. But then I ask myself, after all that I've been through and the lack of trust that I have, how do I measure the risk or benefit of participating? How would I choose the study to participate in, as a poor outcome may lead to further irreparable damage? Being so young and living with such a debilitating disease leaves me with so many feelings. I feel guilt that I am 24 years old and my mom is still trying to take care of me and protect me despite our own health challenges. I feel guilt that my fiancé may have to care for me in the future and I might not be able to work or contribute to our household. I feel frustrated, sad, angry, and disappointed in our healthcare system. I have so many real fears when it comes to my future, fears that I shouldn't have as a 24-year-old. I fear the inevitable total joint replacement. I fear the potential disfigurement of my face and the damage to my facial nerves. I fear the continued relentless pain, even if I move forward with a total joint replacement. I know the grim reality of continued pain even after surgery. I fear the financial burden placed upon my marriage. I fear the impact that this disease will have on my abilities to someday have a family or even care for my family. I fear that I will never be able to live a normal life, travel, eat normally, feel the kiss of my husband or the kiss of my future children. I fear the reality that we could go another 40 years in medicine with few gains, limited research, and minimal science to help. I would love to be able to consider stem cell therapy or tissue engineering, but currently there is nothing being offered for the jaw. Instead, I wait. My jaw continues to decline, and every day I move closer to a total joint replacement, which may improve function, but may not improve pain, with the added possible risks of face and nerve damage. I have received so much love and support from the other patients in this room. Their long and painful journeys, their loss, and their suffering is nothing short of horrific. I look at them, I listen to their stories, and I am petrified that this could one day be me. I pray that my future and the future of all other TMD patients looks very different. I've read that it is estimated that there are currently millions of people suffering with this disease. We deserve more than what we currently have. I'm hopeful for change and advancement in my lifetime. I would like to be a part of the solution. I ask you to please try to make that change and advancement a reality. Thank you.